Welcome! My name is Lila Taft. In this video, I will be describing a nursing education project about Foley catheter care and management. Briefly, this video will review the what, why, and how of developing catheter care related nursing education for my facility. Obviously, the what is Foley catheter care. But why is this topic important enough to warrant an educational program? According to statistics from various government and national organizations, catheter-associated urinary tract infections, or CAUTIs, are a serious healthcare problem in the United States. The CDC receives reports of over 500,000 CAUTIs every year. The healthcare-associated cost of treating CAUTIs is approximately $7.5 billion. Not to mention that treatment of CAUTIs also increases patients' length of stay, may increase risk for other health complications, and leads to decreased patient satisfaction. According to most recent data, national CAUTI rates have increased 6% since 2009. Unfortunately, this problem is worse in the state of Georgia. Georgia CAUTI rates are 36% higher than national rates. About 1 in 4 patients experience catheterization during their hospital stay. In other words, a very large number of patients are at an increased risk for an all too common and very expensive healthcare-associated infection. The high incidence of this infection and its significant implications led the Joint Commission to make CAUTI prevention one of its national patient safety goals. Nurses are responsible for the majority of catheter insertion and care in hospital settings. Therefore, nurses are perhaps the most important resource in CAUTI prevention. Now that I have determined why this education is needed, I can determine how to best educate nursing staff. First, I must decide what I hope nurses will learn or be able to do after they complete this education. So I have created several learning objectives and goals for this project. Objectives are more short-term expected outcomes and may usually be completed immediately after a class or presentation. For this project, the learning objectives are as follows. After completing the education, nurses should be able to demonstrate appropriate Foley catheter insertion. They should be able to discuss appropriate Foley catheter care. They should be able to verbalize criteria for insertion, retention, and removal of Foley catheters. And finally, they should be able to describe interventions to reduce catheter-associated urinary tract infections. Learning goals are more long-term outcomes. They define how practice is expected to change once education is implemented or integrated into normal activities. Learning goals for this project are as follows. Within 1 month of completing the education, staff should apply principles of asepsis and catheter care. Departmental CAUTI rates should be decreased by 50%. And catheter indwelling time should be decreased to 2 days or fewer in appropriate patients. Next, I must figure out how to provide all the nurses in my facility with this education. Depending on the size of the facility, the number of nurses can range from several hundred to several thousand. Obviously, trying to work around several thousand different schedules can get tricky. So creativity and knowledge of resources is important. Also, a tiered approach can help as well. A tiered approach uses multiple strategies to reach as many people as possible and to accommodate as many different learning styles as possible. Fortunately, my facility has many different resources to provide various methods of education. Some of these different methods include hospital-wide nursing summit, staff meetings, online web learning, and posters and flyers. The Nursing Summit mentioned earlier is a monthly educational presentation that is available to all staff. This presentation is held at different times to accommodate as many different shifts as possible. The presentation includes some form of audiovisual and sometimes hands-on education. This catheter education can also be adapted into an online web learning module. My facility has resources to provide all staff with access to various web learning modules. This method can reach staff who are unable to attend the summit. Its educational material could also be distributed to department directors for use in departmental staff meetings. This method could reach staff who are unable to attend the summit or complete the web module. It could also help reinforce the education, and it could also provide a way for staff to ask clarification questions in a smaller work group. Finally, posters and flyers could be placed in staff areas. These flyers could highlight important points about catheter care, provide information about further education for interested staff, and serve as visual reminders for the staff. To ensure that the learning objectives have been met, various evaluation methods are also used. A short test is added to the end of the web modules, and department educators could complete a skills checkoff with staff to ensure proper techniques are being used in catheter care. This concludes this presentation. For questions or further information, please contact me via the email listed in the description below.